This segment sponsored by Bristol Myers Squibb.
According to the American Cancer Society, this year alone, more than 30,000 people in the U.S. will be diagnosed with multiple myeloma, and more than 12,000 people will die from this disease. Now, cancer experts are exploring ways to work with the body's immune system. Oncologist and Hematologist Dr. James Berenson joins us today with more about the recent research and treatment options. Hey, doctor, how are you doing?
I'm doing great. Thanks for having me.
It's a pleasure having you as well. So let's get right into it. What is multiple myeloma and who does it really affect?
Multiple myeloma is a bone marrow-based cancer. It mainly affects the elderly. Average age is late 60s at onset. It's much more common in African Americans, slightly more common in men than women.
Gotcha. So what is immuno-oncology and how does it work with your body's immune system?
Well, as you're probably aware, the immune system is what you use to fend off bacterial and viral infections.
Yeah.
But what we've learned over the last few years is that you can actually harness the immune system to get rid of cancers such as multiple myeloma.
Gotcha. And new research was recently presented internationally. What does this mean for the multiple myeloma community?
Well, at the EHA meeting in June, there was data presented that a newer drug called ImplicitE, an antibody that harnesses the immune system, when combined with Revlimid and dexamethasone, which had been the gold standard, improves the time during which patients' disease is under control compared with patients who receive ImplicitE and dexamethasone alone. Now, I've done a lot of clinical trials and led them for Bristol Myers Squibb with this drug, and excitingly, this drug seems to be improving outcomes. Now, there can be side effects. There are some infusion reactions from the ImplicitE. They're pretty uncommon, though, and sometimes liver problems, infections, and secondary cancers can occur.
Okay, so where should patients and caregivers go for resources to learn more about multiple myeloma?
Well, if they want to learn more about ImplicitE, go to ImplicitE.com. You'll learn that this drug is approved for patients who have received 1, 2, or 3 lines of therapy. You'll also learn how it's given, possible side effects.
Gotcha.
If you want to learn more about myeloma in general, you can go to imbasInBoyCR.org.
Thank you so much, doctor. This information is super important. It was a pleasure speaking with you today.
Thank you.